the Country Innovations Meeting. And today we have a very, very interesting topic that I would like to discuss. And would like to welcome everyone from around the world, Nigeria, UMB, Baltimore, Malawi, Kenya, Tanzania, all over the world. So we welcome you. So today's topic is stakeholder engagement series, because we're hoping that we'd have other topics. And today we'll be turning our perspectives on ethical and the community. And our speakers for today are three renowned individuals, and I'll start by introducing them. I'll start with Prof. Professor Richard Adegbola, who is a medical microbiologist. He obtained his PhD from the University of Dundee, Scotland, and presently works as a consultant and research professor at the Nigerian Institute of Medical Research, where he mentors and teaches early career researchers. His extensive career spans the pharmaceutical industry, philanthropy, academia, diagnostic microbiology across 3 continents. Over the last 3 decades, he's held several key positions, including Global Director of Scientific Affairs and Public Health at GlaxoSmithKline Vaccines Belgium, a Senior Program Officer, Global Health Program, Bill and Melinda Gates Foundation in Seattle, USA, Professor and Head, Bacterial Diseases Research Program, Medical Research Council in the Gambia, at the London School of Hygiene and Tropical Medicine, and several others. Professor Adegbola has authored 6 book chapters and more than 250 peer-reviewed articles on vaccines and vaccine-preventable diseases. His work has garnered 52,000 reads and 23,000 citations. He currently serves as chairman of the National Health Research Ethics Committee, Nigeria, and a trustee of Sabin Vaccine Institute, Washington, D.C. I welcome you, Prof, to this meeting. He's going to lead the discussion. And then next on the panel, I'll introduce Mrs. Mary-Gloria Orji-Nwajiogu, who is a 2-time breast cancer survivor spanning 14 years. She is a patient advocate and the president of the Network of People Impacted by Cancer in Nigeria. It's a not-for-profit organization that advocates for cancer patients at different stages of treatment, from diagnosis to survivorship. You're welcome, Mary. Also on the panel is Mr. Abayomi Aka-Bashorun, who is a lawyer and the current executive director of ICARH, standing for International Center on Advocacy for Rights to Health. He has actively been involved in advocacy for the recognition and promotion of rights of LGBTIQ+ persons in Nigeria for over a decade. And within this time, he has engaged several stakeholders on issues of LGBTIQ+ persons at different local, regional, and international human rights forums. Abayomi is a certified HTS counselor and tester, a training of trainer for the LGBTI paralegal services, a safety and security expert within the Nigerian context of LGBTI issues and cases of human rights violence against LGBTI persons. His ambition is to mainstream LGBTIQ+ rights into the broader human rights framework at the national level in Nigeria, and through the client-centered approach to service delivery, he hopes to create a space at ICARH that is safe, but also provides specific and inclusive services of all queer persons in Nigeria. Abayomi, I welcome you. And on this note, having now introduced the panelists for today's meeting, I would like to hand over to Prof, who would take the lead. Prof, over to you. Thank you.
Oh, thank you. Thank you very much, Dr. Adegbola. Good morning and good afternoon to the audience everywhere from all over the world, as it were. I'm really very delighted to be here to participate in this important meeting. Let me start by thanking Dr. Adegbola and the organizers for inviting us to speak and lead the discussion. I hope very much that it will be an interactive kind of session. But when I was asked to join this, I was excited. I think she will recall that in my response, I said, wow, this is a subject of interest to me, not only because of my current role as chair of the National Health Research Ethics Committee in Nigeria, but for me, having done research for many years, I know what it means now, actually, for community to participate with you and own your study and the outcomes with you, because the outcome actually becomes much more impactful than just writing publications and papers that do not have impact on people's lives. So this is something that I became interested in this over time. And in fact, also presently, I also chair a community advisory board for an important study on mpox in Nigeria. So I would like to share my experiences here, but also I'm looking forward to learning and gaining experiences from the eminent the panelists that will be speaking with me. I'm going to set the context with a few slides and then call on the other speakers to also give their perspectives. And then hopefully then we go into discussion. We're hoping that we'll be economical with time, that I'll be able to do all of this in 1 hour. Thank you. So let's go. My first slides, please. This is what I will cover briefly. Stakeholder engagement in health research. What does it mean? What's stakeholder? How do we do it? What are the benefits? What are the negatives, if you like? Importance of stakeholder engagement. I'm going to talk briefly about ethical considerations. As you can see, it's reflected in the topic. And then what are the community perspectives? And then draw some conclusions. And then we can begin to bring in other speakers. So my introduction will be stakeholder engagement is essential for fostering trust, ensuring ethical standards, and improving the relevance, acceptability, and success of health research or policies in terms of programs, service programs, and what have you. In all of these, ethical and community perspectives are crucial in shaping research outcomes. For me, that's what I've learned over the years, that it's not just sufficient to do a good study and generate data that you think is outstanding, or maybe even published in the Lancet, New England Journal of Medicine, but has no impact on the community where the studies are done. So I'm happy to be alive when this changing is taking place now, that we're now beginning to realize that the involvement of communities is crucial as doing the study itself and generating data. The next slide, please. So what is stakeholder engagement then? The next slide, please. And this is a rough definition. The stakeholder engagement refers to the process of involving all parties or stakeholders who are affected by or have an interest in a specific project, decision, or policy. In the context of health research and service programs, stakeholder engagement ensures that the perspectives, the concerns, and the needs of all relevant groups are taken into account throughout the process of planning, not an afterthought, execution, and evaluation phases. In fact, it goes on even after the study and the whole thing is completed. Experience have shown that in the past, after an elegant study has been done in a location, for example, in terms of health research, and you've generated your data, and the money for the project is over, and the paper is published. You go back 2 years or 3 years to the same location. This has been my own personal experience too. You feel disappointed and, in fact, disillusioned because the thing has vanished. Even if you set up a lab or a system to do the thing, there's no continuity, no sustainability. This is what the bringing community involvement to the issue tends to address. So key stakeholders, who are these key stakeholders in this engagement? They include the communities where the studies or programs have been implemented, the researchers, the policymakers, and funders. So the scope is wide to make sure that nobody is left behind, as it were. What are the key benefits of stakeholder engagement? They include, this is not limited to this, and we're going to discuss this further: trust, transparency, equity. Maybe that's a word you probably hear often again and again these days, both globally and locally, and research relevance. But there are also challenges with stakeholder engagement, depending on how it is actually managed. And I'm sure the panel will be discussing further on those challenges and how we can address them from our personal experiences. My next slide, please. So what are the steps in this process of engagement? You have to be methodological about it. It's something that you really want to do, that you're committed to doing. It's not, like I mentioned, and you're going to hear that from me several times, it's not an afterthought. It's something you carefully think through and plan to implement. So step one, conduct a stakeholder analysis. So with this program I want to set up, this area where I want to do the research, where is the community? Who are the people involved? So serious planning, conduct a stakeholder analysis. Step two, do a mapping and categorize your stakeholders. Step three, develop a stakeholder engagement plan. Once you know the spectrum of the people that will be involved, or communities and groups that will be involved, and you do a mapping, and then do an engagement plan. Prepare a communication plan. How are you going to reach out to these people that you want to get involved in the study or in the program? Step five, execute the stakeholder engagement plan, and then evaluate and monitor as you go along. This is one of the difficulties I've seen actually in my own experience, that we set up a system, a program, or research, but there is no plan that cuts across the period, the lifespan, if you like, or life cycle of the project, to make sure that you are at every stage monitoring what is happening, so if changes are necessary, you can implement them. So the next slide, please. So how do you actually do this in an effective stakeholder engagement? How do you have an effective stakeholder engagement? Like I said, it needs serious planning. The way you plan the study or the program itself is the way you address how do you bring other people into it. And the idea is to ensure three principal elements. The materiality. What are the key issues of concern in this area that you want to address? How complete it is. Bring everything to the table, as it were. Their concerns, their issues, logistics, enrollment. What are the things that are of concern to people? What are their fears? What is the misinformation that's already in the community? Bring everything to the table. And then the responsiveness. When you put all of this together and the community or the stakeholders are responding and giving you feedback, how responsive are you in terms of making use of them and implementing them so that they can see that you're not fake, that you're not just pretending, that you're not committed to. So the timeliness and the way how serious you engage with them in terms of making use of the information that you receive from the community and the stakeholders, we make or break the attempt to have an effective stakeholder engagement. So you need to think strategically, you need to analyze and plan, you need to strengthen the engagement capacities if it's necessary to build capacity, and we're going to talk about that later. Because if people cannot, because they are afraid or they don't have the means, they don't have access to information and what have you, you might need to actually to provide some training and capabilities so to make sure that they can actually contribute effectively to the process of engagement building. And then so you need to design a program and the process itself and how to implement it. The act, review, report, and modify as you go along as it may be necessary. The next slide, please. So what are the components of stakeholder engagement? In all of these, what elements do you actually focus on? The next slide, please. And I'm not going to go to details, but you can see the points here. Maybe we're going to also emphasize them on later on, but you want to be inclusive. You want inclusive participation. So you need to spread your net wide, as it were. Don't leave anybody outside of it, particularly vulnerable people or the hard to reach area that we completely neglect. We are doing the study and making the program, but when it comes to implementation, we say they are hard to reach. It needs to be brought forward. How do you address the hard to reach people, even from the planning stage? Collaborative process. Communication, as you know, is a two-way process. So it's not top-down kind of approach. You're listening, you're reacting, you're giving answers, and you're getting feedback and responding to them. There must be transparency and accountability in engaging stakeholders if you want them to actually, if you want them to collaborate and cooperate with you, you have to be transparent in the way you're dealing with them. The next slide, please. It needs to be culturally relevant. That used to be a problem in the past, and I think that is gradually disappearing. And we need to be sensitive to people's cultures. Culture is a way of life. One culture is not better than the other. You cannot go to them because you want to do a study or implement a program that we have designed it. This is how it's going to be. They need to be part of what is acceptable to them if it's going to work, if they're going to accept it. It enhances research relevance and impact. I think I started with that. My personal experience shows that very well, that when you do the study with the community, they own the study with you, they own the data. I've had experience in my studies where people who work with me from the Ministry of Health, they go to meetings to present the data as their data. They say, our study in the Gambia shows this. So you can imagine when it comes to implementation, you are not begging them, because it's their data. It's their data. They've actually been speaking about the data as their data. So they don't need convincing. If the data that is credible, that they know is going to impact their communities, you don't need much ado to ask them. In fact, during the process of engagement itself, in the process of implementation, you might be thinking actually, even before the end of the study, if you're generating data, they know, look, this is going to be tremendous impact in our community, that they are willing to do that at the end of the study. And this last one is good participatory practices, where you deliberately collect data or engage stakeholders at the beginning of the study itself to co-design, to co-implement, and co-interpret the data. And so if they are involved all along, how can they turn around and say, so if you do all these three together, you can see how easy it would be to co-owner, to have co-ownership of the outcomes of the study or the program. And it makes implementation, access, and acceptability a lot easier in terms of relevance and impact of the outcomes to the community. The next slide, please. I think I'm almost getting there. So what are the ethical considerations? They include these principles of ethics. to respect the individual to take their own decision, personal decision, and make contribution in the sphere. The beneficence issue with regard to ethics in terms of benefits, balancing benefits with risks to make sure it's tilting toward benefits. And justice, in other words, to equity about sharing responsibility in terms of participation in clinical study and benefits, to the risk and benefits together. Is not tilted in one way or the other. Addressing the role of informed consent and community ownership of data is important. It's an important issue in terms of ethics. We are still having issues with that, even from my own experience now at the National Health Research Ethics Committee in Nigeria, where an investigator say, we cannot share, we demand in terms of dissemination of the outcomes of your study or program that the community that you are studying, break it down to them so that they can understand what your outcomes is, not the paper that you published. I mean, they are not stupid. If you break it down to them, they will understand and they can respond to that. And you see some investigators say, we are going to publish our papers. Okay, you publish your paper, and that's the interpretation to the community is that you are doing the study to publish your paper and become a professor, not necessarily actually to help them. But if you're a professor, you should be able to break it down to them to understand what it's going to do to them personally so that they can decide. And that's I am trying to emphasize that based from my experience, what I'm gathering now, that even investigator can say that don't see, we need to make them realize it's important actually for them to, you cannot go to somebody and work in the community, even bring them onto the advisory board and what have you for 5 years or 3 years, and then the end is just publication. That's not good enough. And I think even the big journals are actually now asking questions about what is the community involvement in your study before they accept your data for publication. Addressing potential conflicts between community needs and research objectives is crucial. And ethical frameworks, including good participatory practices, as the job mentioned, is also important. The importance of bringing them in at the beginning, not when you have done your design and everything, the study is ready to go, is when you are running around to rush to bring communities. It's getting them involved right from the planning. Even when you are thinking about the study, visit the community, understand them. What are their issues? What are the problems? Can you bring that into, it takes a lot of effort, but I can tell you that even for the researcher or the implementer himself or herself, it is very, very rewarding. My next slide, please. So what is just briefly about the Nigerian context, just who may not be familiar with that, I think many of you do. There's a National Health Research Ethics Committee. It was first inaugurated in October 5, 2006 in Nigeria. It was supported and strengthened through a partnership between the Federal Ministry of Health and the West African Bioethics Training Program based at University of Ibadan. This partnership enabled the development of the National Code Research Ethics that we implement now. Is also being revised. It's a dynamic kind of document. The code served as the major guideline for the operations of the NHREC and other ethics committees in Nigeria, and was further strengthened by the enactment of the National Health Act in 2014. I think we are one of the very few countries in Africa that have a law that's actually guiding the operation of the National Health Research Ethics Committee. I think it's a good thing, although we still have a long way to go. The third NHREC that I chair currently was inaugurated at the Federal Ministry of Health, Abuja, on January 23rd, 2024. The next slide, please. So what are the community perspectives? And here I took a definition from WHO, a WHO publication. The WHO, the World Health Organization, defines community engagement as a process of developing relationship that enables stakeholders to work together to address health-related issues and promote well-being to achieve positive health impact outcomes. Basically, it's a statement of what I've just been saying. It's a process by where you get all the stakeholders, all people that have interest in one form or the other, either by decision, by implementation, or even use of outcomes onto the table to make sure that everybody's involved. So we don't leave somebody behind. And then when it comes to implementation of the outcomes, we start having issues because they've not been part of the process. Community engagement in health-related research is acknowledged as an ethical imperative. I think I've shown that in the last 2 slides. The overall objective of community engagement is to engage with local stakeholders' views and expertise in ensuring the research is planned and implemented in a way that is acceptable, that is feasible, and relevant for potential participants. It's in a way that is acceptable to them, is feasible, and relevant for potential participants. The next slide, please. So I think I've covered my topics in terms of what stakeholder engagement is, in terms of ethical perspectives and community perspectives, in terms of benefits and the challenges that we may face if it is not implemented well. So in conclusion, therefore, in general, stakeholder engagement improves informed decision-making process of a program or a study, making sure it's inclusive. It is culturally sensitive or improves cultural sensitivity. It improves trust and collaboration through the process of the study or program. It actually improves early recognition of ethical risks and mitigation. Because if they can tell you the issues upfront, they might actually also provide mitigation. This is our issue, this is our concern. This is how we can deal with that in our community in a way that is acceptable to our people. The research, it encourages or improves inclusive research, because you are bringing everybody that is, it used to be a time of, give a practical example of inclusiveness, where whatever study you do, you treat pregnant women as untouchable and you don't include them in the studies. And then when you want to implement, you say you don't know whether you can give it to pregnant women. Why can you not discuss that at the beginning of the study? Is there a way that we can implement that? At what stage in pregnancy can we do, that kind of thing. It's a practical one to note, for example, of inclusiveness, or exclude some people because they are not prominent in the community and what have you. Those are the very people that you need probably maybe to be part of the discussion so that you can include them in how you implement your study. So, and of course, acceptability and co-ownership of research outcomes, for me, is crucial. And everybody wins is actually the outcome of the outcome of that at the end of the day. So population engagement is at the heart of all successful research initiatives. We need to engage communities. If you don't get anything from this, please remember this last statement. Engage communities before, during, and after the research. I think that's the end of it. Is that the last slide? Yes, that's it. Thank you so much. I think with that, I've set the stage. And I'm now going to go on to call the next speaker. And that is the lawyer, the barrister. Can I call you barrister? Aka-Bashorun, to give his own perspective about stakeholder engagement. Please, if you can do that in about 8 or 10 minutes, so that the next speaker, and then we can then again discuss again. Over to you.
Okay, great. Thank you. Thank you. Good afternoon again, everybody. And sorry, I'm going to try to talk as fast as possible so that I can compress so much in a little space of time. But if you cannot hear me, please just signify and I can try to, slow my pace or slow my roll. So you basically said everything, but I think I'm going to give it like a community point of view, or would I say a practical point of view from how my experience with community stakeholder engagement has been. From my perspective, there are so many ways through which you can look at stakeholder engagement at the community level, at the government level, at the board level, at the staff level, at so many levels. But particularly when we talk about community stakeholder engagement, it basically means reaching out to your community, understanding the target population that you want to work with, and reaching out to them saying, okay, oh, we have this intervention we want to provide to you, and this is how we want to do it. How do you think we can help you, help us make the best outcome out of this for everybody? Where you win, we win, and it's a win-win situation for everybody. And in that instance, you often find people who, when we talk about stakeholder mapping, we talk about people who can probably be, would I say gatekeepers, or would I say community representatives or key opinion leaders within the space that can actually, speak well to this issue within their context and within their environment. And in that instance, you have persons coming up where you have a needs assessment, where people speak, you ask open-ended questions where you talk about, okay, this is the situation. Like when I first came to ICARH, the first thing I felt they need to do was that I need to understand what the context was. I was working in Lagos in a very, would I say, liberal environment, and which mostly had a lot of Christians as population within the space. And I just moved to North Central, a space where it was highly religious, conservative, and you have Muslims and Hausa-speaking persons within the space. Obviously, I'm Yoruba, so I needed to understand the context and how I was going to come in to provide the best service for my community. So what I did was I organized a community focus group discussion. And through that focus group discussion, the idea was to meet different demographic of persons within the community, understand, so that I can get the best perspectives from it. And it was from this conversation that I understood that there was a high illiteracy level within the community. And it was important for me to start creating interventions that can actually help community members not only be better in terms of understanding the services that we provide and be able to access it, but also to develop themselves as individuals and be, would I say, responsive members of the society. You get what I mean? So that way, I was able to fashion out through a particular funder a development training program that allowed us to be able to key into that process and, look into that aspect. As at that time, we were able to meet over 600 Hausa-speaking persons who were able to educate, sensitize, and develop their capacity in terms of reading, accessing, and proper communication with individuals. So those are some of the things when we talk about the importance of stakeholder engagement. It's also important for you. Also, messaging is also important. The kind of messaging that you churn out is also important. How you churn them out is also important. Sometimes it's also important for you to organize, would I say, like a messaging workshop where you have everybody come together to say, okay, these are the things. So, for instance, now, before messaging to me used to be Hausa, English, Yoruba, and Hausa, English, Yoruba. Now I understand that within Abuja context, you also have to have the Badi language. You also have to have other aspects of the Hausa language, and you have to include it. So that is basically you working with your community, following them step by step, and working in line with them. And I think it's basically the best thing that you can do for strategic planning. When you're developing a project and you're trying to get the best outcome out of it for everybody, it's an integral process of strategic planning. Understanding your community, even during your mapping, you also need to understand those who are of high interest, high influence, low interest, low influence, those, that can actually meet the markers of what you want. And it's also important that you follow up with them. For example, now, when you come to the ICARH clinic, I think one of the most amazing things that we've done is to provide, would I say, very integral services. For example, now, our impact project, which looks at inner work treatment. That is a service that is key directly to the needs of our community, because that was one of the things I identified that was also lacking. I would get calls in the middle of the night of community members crying, talking about the pain they've been going through for over a month. And then lo and behold, this project comes and provides some kind of, mitigation to that issue. That is you following up with your community. That is you understanding the needs and the wants of the community. And that is when a program is designed to understand, to look at the sensitivities of your community and responding directly. Another thing we were able to do is to provide mental health services, knowing that half the time our community, our clinic, both in and out at the field and within the working space, they have clients who often go through so many kind of emotions when they get their test results, either as an affected person or even by their partners of such instances. So the need to provide an avenue for people to be able to air their mind, freely speak, get mental health, focus and direction also came in, and we introduced mental health services. So this, for me, is a practical process for me, which I really, really appreciate, because it allows us to look at the direct needs, wants, and concerns. And another thing that I see, which is more important now than any other thing, maybe we'll have these conversations along the line, is the fact that we need to start creating sustainable, interventions that will last. When we talk about sustainable interventions, meaning you mentioned something about having a project and then 2-3 years after, you go back there and you're saying that everything has gone back to ground zero. We need to start creating instances. For example, at the initial stage, 10 years down before now, we had intervention programming on HIV intervention for the community that brought sensitization workshop, entrepreneurial skills development, and half of them didn't go anywhere because there was no proper planning towards it. They just thought, okay, if we have to meet this number of people, we need to do things that will be attractive to them. So let's do actual programs that have slide parties in it. Let's have sensitization workshop that they can come, eat rice, and collect money and go. That thing didn't go anywhere because one of the follow feedback that I got, I was at a particular training, and the day 3 that we were done, this person, the jotter he was holding that he used to write from day 1 to day 3, he just threw it in the dustbin right there in the same hall and he walked away. So you can imagine, they've created spaces where these community members understand what is coming to them. Another example I can give was when I also came to ICARH as executive director, the Hausa committee came to me and they said, sir, we acknowledge you. We say you are trying, but what are you going to do for us? And they brought a particular CV to me and said, this is what they want, that I should hire somebody, and so that the liaison can be okay. Some of these interventions brought tall orders that new interventions now are not looking at. Because what? Back then, they saw that it wasn't working. And instead of finding innovative ways to make them work, like creating sustainable measures like sponsorship programs, or liaising with vocational skill institutions that can continue this process on some kind of level, they didn't. And they just went with the times and said, no, some of these things didn't work in the past, we're not working with them, we're moving forward now. That's kind of insensitive to the community that you've already exposed to this kind of things. I think I'm going to stop here now, or do I still have enough time to continue? If not, I think it's a good place to stop.
Thank you so much. That's so practical. I can identify with several things that you were saying. And I took note of some things that you said, like having sustainable intervention, responding to the community's needs in our plan, and working with them. I caught that. Working with them, not working for them, or not. It's working with them so that they can trust you when you work with them. As a researcher, we are just too focused on our research. Of course, we have to, because we are funded to do that. But when you walk into a village and you say you're studying meningitis, and then the mothers in the village, even if they didn't go to school, but they said, look, meningitis, yes, but we don't have good water. It's water. We don't. It's water. What they need is water. Sometimes what we're pushing is not what the community needs. We can make them understand and bring onto play what they say is their concern. That's how to work with them. That's how to build sustainable intervention. Because when you do that, they also accept what you are bringing so that everybody wins. Anyway, but we are going to come back to you. Thank you so much, Mr. Aka-Bashorun. We are going to come back to. We need those practical tips, those practical experience, if we're going to be successful. And start asking questions. Why have we been doing this many studies, this many years, and the community remains the same? we should start. We must be doing something that's not right, or not 100% right. Anyway, but we're going to come back to that. Can I humbly call then Mary-Gloria Orji-Nwajiogu to please take the floor now and give us your own perspective again on the stakeholder engagement and how you have found it with your community and your network. Over to you, please. Mary-Gloria.
Thank you so much, Prof. Yeah, I just unmuted myself. Can you hear me?
Yes, we can.
Okay. Thank you so much, Prof. In fact, your presentation was super, and it's like you have actually said everything. But let me also come from the cancer patient, perspective. My group, especially, there are some. Ours is quite unique because even as we speak, there are some medical professionals that still believe that cancer is a death sentence. Yes, they are in the system. Yes, they have seen a lot of people that survived it. But maybe most of the people they know had their treatments abroad. So it's as if they don't even trust the health systems here. And so when you're talking about engagement of stakeholders, the patient is the least they think about. I'm going to tell you one thing, and that's to tell you so that you understand where I'm coming from. One of the pharma companies, they actually prepared a very, very wonderful program, not even here, from Ghana. I was to join online. And when they approached me, I was like, okay, great. I don't have a problem sharing my stories from the patient's point of view and stuff like that. But I told them one thing, please, when you guys are going to have this, give me like 2 weeks so that I can prepare myself. Tell me what I am going to speak about. I don't have any problem speaking on anything you guys want us to do. It's fine with me. Do you know the professors that were to be speakers, the doctors that were to be speakers, everybody was carried along, apart from myself. And they told me this, that I'll be involved. In fact, that the program is going to take place tomorrow at about 2 p.m. And as at the time you were telling me this, I traveled for my best friend's brother's burial in the village where the network was not even okay. And I was like, why are you guys talking to me now? You didn't tell me this early. Tomorrow you're talking about I'll be in the middle of the burial. There's nothing that will make me to miss that burial because that was even the reason I traveled. To be honest with you, at the end of it all, the whole thing was muddled up. And do you know what they did? They kind of turned the whole thing against me. I don't know what happened behind, but I was chatted up and said, were you not informed? And I was just informed yesterday. And after that, oh, forget about it. And since then, they didn't have anything to do with me. And the feeling was mutual. So you find out that everybody else is carried along, apart from the patient community. And these are the people you need to buttress whatever you are putting out there. Prof, I so much liked what you said about, this engaging them before, during the planning stage, real thing, and then the execution, and even the follow-up. Because that's a huge problem we have here. I don't know whether it's because they expect that we are definitely going to die, so there's no need. But the funny thing is that on occasions where you need the voice of the patient, you still go around and get one. Why will you do that if you don't have any hope? Why will you do that if you don't believe that they are important? So these are the things in my community. If you don't engage us, just like you mentioned, sometimes they even engage us when they have already made up the plans. And then when you come and you're bringing in your own views, they'll be like, look, this thing has to go through so many processes. We cannot start changing it now. But you want us to come and approve whatever you have planned without our inputs. And this has been going on for a very long time. Yes, I am glad our voices are being heard. We are insisting we should be carried along. We are now going forward. We are no longer picking. Initially, yes. I'm not an activist. I call myself an advocate. And sometimes there are ways to also engage them. Sometimes I force their hands. Sometimes I beg. Sometimes I grovel. Sometimes all right out our fights. So it depends on the situation we find ourselves. That depends what we present. But if these engagements are done with us, we ask, first of all, it will elicit trust between us. To me, it should be a win-win for all of us. It shouldn't be superior. No, nobody is. See, to me, as a cancer patient, I wouldn't want you to even be in our midst because I don't want you to have cancer. It's not a good thing. So for the fact that faith actually brought us into this thing, I think it should matter to you that we need that trust from you, that whatever you want to do with the data you're getting from us, it should be for our betterment. We should see it as something that even if I as a person don't gain, personally, let my group, let others coming after us gain from it. We should be able to be thinking that way. We should not look at the patient, because when you look at us, if I tell you stories we have heard from my group, we are over 200. And the coalition we have formed, we are even over 300. So you can imagine when 300 cancer patients are together, bringing in, talking about their needs, talking about the way forward, deciding that we want our voices to be heard, that we want to be at the table when policies are being made about what concerns us. Well, we are talking about it, and you kind of, I don't want to say you were not intelligent enough to bring us on table. And then in the process, you're bringing us in and you're telling us we have already done, then why bring us in the first place? So this, to me, that has been the base of most of our researches. And when you mention that you do a research and when you go back, it definitely will be scattered because someone said we are not there. So why would we promote it? But if we were there, yes, even if I die tomorrow, I have people that will take off from where I stopped. So the continuity will be maintained. But if someone said you didn't call us, everything dies with you, and then you come back and you're expecting a miracle, it wouldn't happen. So stakeholders' engagement is very, very important. And it should be from the beginning, not in the middle, not at the end, not for cancer patients to say, oh, they were there when we did this thing and they have, but we don't want to approve anymore. We want to also formulate so that the approval will be wholesome, so that we can even help you build that trust among the patients. I attended a forum and they were talking about spending almost like $250,000 trying to recruit cancer patients for a clinical trial in Nigeria. And I was like, really? This is what is under our fingers that we can even do for you with the minimal amount of money. But you prefer not to bring us along. You prefer to go in and start recruiting. You prefer to, a lot of us, if you come that way, we say, this one wants to use, or they don't collect money. The Nigeria, they have collected money, and now they want to come and use us as guinea pig. But if you carry those along from the onset, that this is for our benefit, we would know that, if this is done, we will be able to get these drugs when it is ready. We'll get it free. We will have a special care because the monitoring for those on clinical trial, it is very, very apt. It's not like others. We will look at the advantages. And when we look at it, we tell ourselves, okay, this person is there. If these people are there, why not? There's something I posted on our WhatsApp page. And a champion, that's what we call ourselves, cancer patients. A champion said something. And that thing really touched me. She said, I didn't listen to this, but I am in because I have seen that is our president, Gloria, that wrote it. That is the kind of trust we have built among ourselves. So imagine when you now make me, I'm a part of the committee, and I go there and I bring it to my people and say, this is what we are planning to do. Do you need so much money to spend to get what you want and get results easily? So when you don't engage us, don't be surprised that You may start, but you will definitely not end well. So let me stop there. Thank you, Prof.
Sorry, I was muted. Well, look, thank you so much, Gloria. I mean, that's so touchy. I mean, your personal experience with a group of people who live with cancer. And I think you are champions. I mean, I think appropriately so. Yeah. And I think one takeaway for me from what you just said is that patience should be the key. I mean, if they are they're the people you want to at the end of the day want to help with your data. I mean, why should they not have voice at the table when you're deciding to do what you want to do? To understand you maybe the guy that's studying people with cancer hasn't got cancer, so has no experience of it. I mean, the best possible way is to bring people who have experience of it so that that enriches your plan and even the implementation of the program. Quickly before I go back to Mr. Aka-Bashorun, you mentioned something which I caught about your posting something, and because your members trust you, they believe that. And the impact that will have if you were having a stakeholder meeting, say somebody wants to, an investigator and whatever you that is set that up, how that we mean, and I'm trying to connect that to misinformation that is so common these days. I mean, how will you know have misinformation where you don't know who to trust? I mean, how is that? How do you think stakeholder engagement? And I'm going to go to Mr. Aka-Bashorun to talk a little bit about that. How do you think? Because misinformation, because of the online issues now, everybody is an expert on any opinion now. Nobody checks anybody. Everybody goes online and I don't know. I'm sure you know what I'm talking about. How can stakeholder engagement deals with, how can it minimize, even if it doesn't eliminate that, the issues of missing? Take COVID-19 in Nigeria. How can people take vaccine when they don't even believe there was COVID? I met people in the community where I live that I have to really become an agent of explaining what COVID is to everybody that I meet all the time, because they don't even believe. So when the vaccine came, how do you want people to take remedy for something that they think is not existing, that they are just faking and fooling us and keeping us at home? So how can stakeholder engagement, because of the fact that people come together, share information through people that they can trust, what impact can that have in reducing information and improving the programming and research studies? Over to you. Do you have any thought about that?
Yes, I think if I got it right, you are asking about how we can ensure trust within our community and avoid misinformation in terms of project implementation.
And I want both of you to make comments on them. So please go ahead. And then we go back.
So for me, I think it's very important the platforms that you actually liaise with in terms of partnership. I think it's very important the foundation that you're coming up with. Say, for instance, now there are some certain communities. If you mention a certain funder, they will tell you they're not interested. Not because the organization or the funding organization is generally evil, or let me, for lack of a better word, but for the fact that at some point there was a level of miscommunication with them, and certain people who represented them did not do proper due diligence in doing their responsibilities as they should. So you see people saying, no, they don't. So the kind of platforms that you start with or that you leverage on in terms of community-based organizations are very, very crucial. So another thing that's important is also having evidence-based advocacy, evidence-based engagement. Meaning if you're trying to, sell a product or sell a particular initiative, say for instance now, like you mentioned, you talked about COVID and you want people to talk about it. There are instances where we got so many information via CNN, via Al Jazeera and a few other things, showing records of death, the experiences of other persons in other parts of the world. I mean, anybody who has access to that kind of information cannot deny the fact that there are certain things that, like COVID or certain viruses that exist that are actually killing people. And even if they don't believe, they will be pushed enough to want to make their own findings, to understand for themselves, okay, I've seen this on television. How do I access information to get better understanding on this? Thirdly, the individuals that you work with at the community level also matter. The kind of information that you share with them also matter. That will mean that you have to have some kind of sensitization workshop with your advocates or with your volunteers to give them insights. You know, like for me, I don't see it as a condescending thing whenever we're having trainings and they bring the agenda and they bring everything and I'm hearing big English. I say, no, break it down. Break it down to the barest minimum. Yeah, some of these people went to school, some of these people understand this thing, but break it further down. Yeah. And when you're done breaking it down, create role play scenarios that will allow them to physically see it.
Yeah.
Lately, our reading culture and lifespan of reading is getting shorter by the minute, by each generation we get into. So when you have so much information that you're writing so many narratives, you have few people reading these things. We're in the social media age now, we're in the TikTok era, we're in the Instagram era, where pictures and a lot of dramatic flashes catches people's attention. So you want to, incorporate that in your information, allow these people get the first-hand insight. And say, for instance, if it's maybe a particular thing, like for HIV intervention programming, whenever we're having our trainings, we ask persons who are living with HIV, that, are you interested in, coming to be a human face to this conversation? Yes, is this something you're comfortable to talk about? Because even as we speak, sir, and everybody on this platform, there are still people who don't believe that HIV is something that is real or can have drastic effects on individuals. So when you bring a human face and say, see, I'm somebody who's been living for this virus for over so years. These have been my challenges. These have been my successes. These are things that I realized. These are the things I'm moving on with going forward. It helps people to have an informed knowledge. It helps that volunteer to be able to go back into the community and say, this thing don't be something we hard now. Maybe they brought somebody to our training that day and the person was even so blah. It gives them the equipment to be able to respond to the community properly and, reduce this level of misinformation. And then lastly, another thing I would say is to create platforms like toll-free lines, links that allow people to be able to click and get all the information that they want. At ICARH, we have toll-free lines, which we're going to, in the next few months, that we're actually going to be expanding to accommodate more numbers, to allow more people to call us real time and to have conversations simultaneously. So those things allow people to they know that it's a toll-free line. They're not going to pay. So if they call, they can talk for 1 hour. It's none of their business. Their own is to get better informed and, follow the information accordingly. Thank you very much. And over.
Thank you. That's very helpful. Those the personal observations and contributions that people can identify with. Gloria, briefly, and then please, after Gloria's contribution to this, we're opening this up for questions from the participants. Please, you can throw your questions onto the chat, and then we'll read, and the panel will address them. Please feel free to post your questions. And if you can also actually, Mary-Gloria, when you're addressing this in terms of misinformation, we've been talking about the positive perspectives of stakeholder engagement. Do we also have negative? Would there be negative outcomes of stakeholder engagement in the way we manage or handle it, from your experience?
Okay, thanks so much, Prof. Well, if we are going to talk about the negative, yes, there should be, because everything that has an advantage also has disadvantage. Okay, let me give you an instance. In a situation whereby you may engage the wrong person. And when I mean the wrong person, I mean the wrong person. No, there's something that was happening at a time. We have a support group. And like I said, we are over 200. And the coalition we have formed is over 300 members. But there are individuals that are also cancer champions that are solo. then you may decide to engage them. They are stakeholders, they are cancer champions, but do they have a community? They don't. And when you do that, you will definitely say to you, you're feeling cool that you have engaged a patient. But will whatever decisions you're taking, policies you're making, will it trickle down to other patients? No. So these are one of the disadvantages. You may be engaging the stakeholder, but it may be the wrong person. And that's why I think some of the meetings I attend outside the country, some in the US, I attended AACR early April this year. One of their requirements is that you must have a community where you can step it down. So if we are able to, put all these things in place and know that these are the criteria before we even start these engagements, then we will definitely get it right. And you talked a lot about misinformation. The misinformation you're talking about, it's huge. And it's sometimes I feel that a lot of people believe that cancer is a way of making money, huge money. There is nothing we don't hear. But do you know one thing that happens? There was a time it was all over the place. If you take chemotherapy, you die. Do you know it was in our group that we were able to counter that? Many of our members started coming out and saying, oh, I took chemotherapy 5 years ago. I am still here. That was what Abayomi mentioned about evidence-based. A lot of us were like, okay, I took chemotherapy, it didn't. Some will even come and say, I took chemotherapy, I got married, I had children. So don't even think that the treatment will prevent you from being fed. A lot of things, we counter it. And these are evidence-based. Nobody's going to lie to you. After all, nobody even wants to have cancer in this place. So you know that whatever information you're getting there is the real thing. So we do a lot of things. We do a lot of misinformation, even the right one that is not passed well. A research that is just, published somewhere that has not even been stepped down, we get it. And they will say, oh, there's something called liquid biopsy. It is horrible. We have not even finished studying the solid one in Nigeria. You're talking about the liquid one that the researchers had just published, and you want it to. These are the things which we say, yes, so it is a clinic. Hey, why are our doctors not doing it? I'll be like, guy, when you go over there, the first thing you do is first CT scan. Here in Nigeria, first CT scan is only one at Mikio in Lagos. It's so expensive, so a lot of people don't. So they have the equipment to monitor, do a lot of it. We don't have that there. So let us make do with the one we have. So we kind of guide, navigate, make us not to fall over the other side, the extreme cases of it is too bad or it is too good. We try to limit within what we have for sustainable in Nigeria. So that is how we counter it.
Thank you. That is helpful contribution.
Great.
Thank you so much. There is a question on the chat that somebody tried to say something.
Yeah, no, I was just going to take over from this part, Prof. Thank you very much. Yes. We just want to thank you guys. I know we're already at the hour, but there are a number of questions that have been put in the chat box. We have to be mindful of time because our time for this meeting is actually 1 hour.
Yes.
But I'm really excited about the engagement and the discourse. It's really been very, very incisive. I do want to take the question that was put in by Ozi Yalome, who is asking, I think the second question, first of all, is one that I would take before the first one. I know we don't have too much time. And the question he's saying is, what strategies can be used to introduce an intervention that conflicts with the interest of the influential community leaders who do not prioritize the identified community needs? I think I would turn this question to you, Prof. If you can just spend 2 minutes and then maybe I will also ask Gloria, and then we can take one more question. We're really pressed for time. Thank you. Over.
That's an issue. Thank you for introducing that. I was just going to the questions, but the approach is bring everybody, be transparent with your discussion. One of the challenges in the stakeholder engagement is that you may have some powerful people because the scope is wide. You're bringing everybody, it's inclusive. So you may have some powerful people that may want to influence the decisions. And you need to manage that well in such a way that if you take the decisions is what you take together, not behind the scene. That's the way to maybe reduce. You cannot avoid that completely, I'm afraid. But the way to reduce it is to make sure that you are transparent in your approach. Let everything be discussed in the open space so that we take decisions together and we own the decision together. Is probably one approach that can minimize the influence of powerful people that may want, it may be political, actually, that we want to do it this way, but it can be done that way with persuasion, with everybody on the table. That might actually dampen that down a little bit. It cannot remove it completely. We're human, but I think it's one of the things that we need to be careful, anticipate and mitigate in the way you manage that. It's one of the challenges that you find in stakeholder engagement.
Thank you. Thank you so much, Prof. Gloria, do you want to add anything? I know you've been very, you say you're not an activist, you're an advocate, if I remember very well.
Oh, yes, I actually said that because it's like activists always fight. No, we are talking about life and death here, so we don't always fight. If I need to beg and grovel and pick crumbs from the table to get what I want, I'll do that. But in some instances, I will need to fight. And I think Prof has really answered that. It's a matter of being open. I try as much, in my community, I try as much as possible to be open. Yes, it's not everything I need to put out there, because there are some things that individually we may translate in diverse ways. And just like he said, you don't know what is in our minds. Some people may come with one sinister motive or the other. But it is always good to be open, to tell them this is who I am. And then when you have issues like that, because definitely it will happen, you trash it openly if it needs to be trashed openly. If you need to call the person privately, because if you trash it openly, it may cost more effort. You will need to balance it out. Should I bring it out in the open? Should I call the person, or should I even ignore? Yeah, there were instances we definitely ignore you. Because there was a time in my book when some people felt that I, as a person, was using them to make money. I allowed it to. I didn't even argue. I didn't, and it was deliberate, because the more you're arguing, you're put on the defensive. I didn't want to be on this. I allowed it. And later, because I believe that when you see me doing the right thing, definitely you will change your opinion of me. And that was what ended up. So yes, it could happen, but please keep an open arms, keep an open book, and let people know exactly what you do. And they will learn to trust you. And gradually it will be.
Exactly. Thank you so much. Abayomi, I saw your hand up. I'm going to give you just 2 minutes, but even as you add a comment, I want you to also tie in the other question from there's another attendee that asked a question in terms of kind of close to Ozi's first question. And the question is, how far in advance do we have to engage stakeholders when met with barriers? So if you can just add, your perspective to that, alongside whatever you were going to say, I appreciate that. If you can do that in 2 to 3 minutes, and then we wrap up because we're way over time. Thank you.
Okay, real quick. Thank you, sir, and thank you, Gloria. Lovely contributions. I just want to say that, when you talk about how far in advance you need to meet your community, from inception that the idea came into your brain, from the inception that you guys have decided to want to work on this project, you need to meet. I think that's the most amazing thing about my collaboration, or rather our collaboration, ICARH's collaboration with the trust units and IGN and everybody within the partnership process in terms of the research project that we've been working on for over almost a decade now. And the idea is once these issues or once these important aspects come up, and the funny thing is we keep realizing it collectively, and then somebody will just come and say, I think we need to do this. And then before you know it, it's coming to my table, we're talking about it, we're setting up our startups, we're setting up meetings, and everybody's going. It has to be the instance it comes up in your mind. Because what? If you start anything, you might lose the entire process in its essence. And to answer us this question, when you talked about how do you get to prioritize, get people to buy into something they don't prioritize, and especially when they have barriers in set in place, it's strategic advocacy, strategic engagement. You need to look at it, like we said, when you are engaging, do your mapping. Look at the people of high influence, of low interest, people of high influence, of high interest. You see those people with high influence, high interest, they are the most important persons you want to engage in. They are going to be your ninjas, so to speak, in the field to help you talk about these instances. Say, for instance, that we want to talk about petrol. We know that is this our Baba that we're going to meet. What's his name? Is it Dangote? What's his name? This rich man that said he's going to buy crude oil from Nigeria. So that is strategic engagement. Knowing the key people that can press or influence the leaders or the government's opinion and things like that. If it's at a community level, you want to meet the community leaders. If you see that it's not working, you meet people that can affect the community leaders. E.g., the community leaders, they will have women's association. The women's association will have the community leaders and the parastatals women in that association that are forming mother of the committee or whatever. There are people, and if they are luckily for you pro to your conversation, there's also another channel of engagement. You know, it's just basically understanding those people and, you know, targeting them based on their needs. For another situation, a particular community that is lacking water, if it's within your, like Mommy Adegbola said, if it's something that you can add within your budget line, include sustainable water measures for them. How will that kind of leader say no to that kind of thing? So you just have to play your cards right and also meet their needs in a very transparent manner, and that is accountable as well too. Thank you.
Thank you very much. Prof, I see your hand.
It will be snappy. It will be snappy. 1 second.
Okay, sir. Okay, sir.
It was I agree with you, Aka-Bashorun. I mean, I've done similar things that not just focus on your study. If they need water, you can campaign outside your study and contribute, make money to make borehole for them. That's the way to do things. But I wanted to emphasize something that is posted by Dr. Adegbola. Is important. For effective stakeholder engagement, we need to budget. So you have to budget for it in your study. So when you are writing your grant, have a line item, stakeholder engagement, cost it. And, you know, the funders will be happy to do that because they know the money spent there will make the outcomes worthwhile and impactful. That's a brief comment.
Thank you. Over. Thank you. It's clear to me that our stakeholder engagement series, we would need to have more of these stakeholder engagement series because I think it brings the perspectives from different angles, which makes the conversation very enriching. Unfortunately, we are way over time. People have to also join other meetings, but I mean, I think we are really, really, really very grateful to all three of you for this very, 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 very riveting discussion. And I'm sure that at some point that we pray that you also be available when next we reach out to you, because, you know, this is this series comes up from time to time. We have these meetings every month, but we have the stakeholder engagement series at certain times. I just want to say thank you on behalf of the organizers, Dr. Sylvia and our dear Jennifer Gonzalez. She's also on the call. She has that beautiful picture, even though she's not showing her face. I want to thank everyone that has been part of this from all the different corners of the Ciheb globe. We really appreciate you guys coming on. We also want to use this opportunity to also appeal to all country teams to try to make sure that you spread the word about the country innovation meeting so that we have more of the attendance, because I think we may be missing some people, but we'll try our best to also communicate wider. But I think this is a big thank you for all the questions. If we didn't address your questions, we apologize, but I think we've addressed Ozzy's question, and then we've also addressed Daya's question. So I would say thank you so much to everyone, and look out for the October country innovation meeting. That one is going to be we have a very, very power-packed speaker who's going to be taking that forward. So on this note, thank you everyone, and see you next month. Thank you very much, and thank you our speakers. We appreciate you guys. Thank you.
Thank you very much. Thanks for having us. Bye-bye.
Thank you, Prof. Thank you.
Bye-bye. Thank you.
Bye.
Thank you, Gloria. All right, bye.
Thank you, everyone. Bye.
You're welcome. Thank you very much.
Thanks.